Hi, I'm Dr. Dimitrios Kostopoulos and I'm a clinical electrophysiology specialist, and today I would like to explain to you why vestibular testing is very important. So here are some statistics. 40% of the population will fall during their lifetime, and as the population increases, the risk of falls also increases. 60% of closed head trauma is from patients who reported dizziness. 20% of the population have a unilateral vestibular loss, while 50% of all adults 65 plus have some vestibular problem. 40% of the adults 65 plus will experience a fall every single year, and 50% of first-time fallers will have repeated falls. So how do we solve this problem? Well, first of all, we have to diagnose it, and this is where VNG testing or video nystagmography testing comes into play. And then we have to help rehabilitate the problem with vestibular rehabilitation therapy or VRT. What is VNG or video nystagmography? VNG testing is considered the new standard for testing inner ear functions. VNG measures the movements of the eyes directly through infrared cameras. VNG testing is used to determine if a vestibular inner ear disease may be causing a balance or dizziness problem, and is one of the only tests available today that can decipher between a unilateral, one ear, or bilateral, both ears, vestibular loss. VNG testing is a series of tests that are designed to document a person's ability to follow visual objects with their eyes and how well the eyes respond to information from the vestibular system. So there is a connection between the vestibular system and the eye movement. And this is what VNG or video nystagmography will specifically test. This test will also address the functionality of each ear and if a vestibular deficit may be the cause of a dizziness or a balance problem. Now, VNG testing is very comfortable and definitely non-invasive. So the patient receives a very comfortable test. It lasts about 45 minutes to an hour, and very soon after the test is completed, we have the results of the test. So the test will demonstrate if we have a vestibular dysfunction, which is more peripheral in nature or central in nature. So once the results are in, we know now how to properly manage this patient. And this patient may be managed with vestibular rehabilitation therapy or may need some further follow-up and further medical attention. But let's talk now about one of the major solutions, which is vestibular rehabilitation therapy. What is VRT? VRT is an exercise-based program that is designed to promote central nervous system compensation for inner ear deficits. VRT can help with a variety of vestibular problems. That includes the most frequent one, BPPV, which stands for benign paroxysmal positional vertigo, and also the unilateral or bilateral vestibular hypofunction. In other words, the reduced inner ear function on one or both ears associated with Meniere's disease or labyrinthitis and vestibular neuritis. Even individuals with long-term unresolved inner ear disorders who have undergone a period of medical management with very little or no success can benefit from VRT. VRT can also help people with an acute or abrupt loss of vestibular function following surgery for vestibular problems. VRT is provided by properly certified therapists in vestibular rehabilitation and can be extremely beneficial to patients with vestibular dysfunction. As you can see, this entire patient management for vestibular and balance dysfunction is a two-step program. Step one, the proper assessment and evaluation and diagnosis of the patient, and step two, the proper treatment management of the patient. And the combination, or video nystagmography or VNG, with VRT, vestibular rehabilitation therapy, can help patients with vestibular and balance dysfunction resolve their problem. Thank you.